Show some pictures of impetigo so you can like better understand it. So here's one of the early stages of impetigo. You can see it, it's like doesn't have red sores yet, but it's starting to look really red. So since they got impetigo around their mouth, you could see it's the stage
2, 1.
And this is like Ariela, and today I'm going to talk about another disease, which is impetigo. So first I'm going to talk about what impetigo is. So this is a really common skin infection that usually occurs in children, and especially young children. And it's when their skin develops these red sores that later break open and release this liquid. And once this happens, it later turns to like a yellow brownish crust. And this is usually the description of like impetigo. And you could see it in like children. It's really common, and it's a really common case also in pediatrics. So impetigo is usually caused by these two different bacteria, the staph and the strep. So both of these bacteria, they can enter through the skin through like cuts, wounds, or even insect bites. So once they enter the skin, it becomes an infection, which later develops into red sores. So now I'm going to explain how it spreads. So impetigo spreads directly through contact. So if someone has like an open cut or wound and then their skin touches someone else's who already has impetigo, then it could spread. And also sometimes like rubbing the infected areas and then touching other parts of the body, it can become infected. Like if you already have it in the arm, if you touch like your hands or like your legs, it can also become infected. So now I'm going to talk about the two different types of impetigo. These are like the two main types. So the first main type is non-bullous impetigo, which is the most common one. And this one is that there becomes like small red like spots that quickly turn into blisters. And in addition, these blisters break open and then they develop this honey-colored crust, and they are usually around the nose and mouth. So if you see these symptoms, it's usually the most common one, the non-bullous one. But then there's a different type, which is the less common one, the bullous impetigo. And these are much larger red sores, and they also like have blisters. They stay blisters most of the time, and since they're larger, they also contain more liquid in them. And it's most common in infants. So if you see, for example, if you see it around the nose and mouth, it's usually the non-bullous one, and if it's smaller. But if it's much larger and spreads throughout the body, it might be the bullous impetigo. So now I'm going to explain how it's diagnosed. So doctors, usually pediatricians, like they easily diagnose it because they recognize it like once they see it, such as by the symptoms I described earlier. So it's really easily recognized. So doctors usually diagnose it just by looking at it. So this is usually the most common way to diagnose it. But there's other ways, like usually if you want to know which type of bacteria, if it's the strep or the staph causes it, a doctor could usually just take a swab of the sore and then take it to the lab. So now the treatment for impetigo. So if it's not severe at all and it's maybe just in a specific area of the skin, then doctors will just order an antibiotic by ointment or by cream. So like antibiotic but applied directly to the skin by a cream or ointment. But if it's more severe, like if it's all throughout the body, if it's from like head to toe, like then they'll order oral antibiotic as well. So the doctor may choose to give them oral plus still the ointment or cream. So it like helps for the impetigo to heal faster. So now I'm going to talk about complications of impetigo. This is like really rare because impetigo is usually resolved in like a couple like days and weeks. But if there are complications, like if it isn't treated promptly or they don't go to the doctor, then these complications could occur. So usually it could be cellulitis, which is a deeper skin infection, scarring, but like this would be like more mild because it's just like a scarring in the part of the skin, and also kidney inflammation, which would be more severe because of the strep or staph virus that will continue like infecting other areas that could lead to the kidneys inflaming it. So now I wanted to show some pictures of impetigo so you can like better understand it. So here's one of the early stages of impetigo. You can see it, it's like doesn't have red sores yet, but it's starting to look really red, all these parts. The lips are getting kind of crusty, and these are like one of the early stages of impetigo. It could be mistaken for a rash, which could later lead to more complications. That's why it's important to go to the pediatrics or doctor, so you could really quickly get antibiotics to fix this quickly. But here's like the early stages, and here it's when it already became a red sore. So here's a red sore that I was describing earlier, which is like the key like symptom of impetigo. It's an open red sore. You can see it over here too, open red sore. So here it's, and this is later stage. Now it has fluid blisters. Here you can see all these blisters that are like forming with fluid inside, and it's getting a lot worse. It's getting more red, So you could see it all around the mouth because it's very common to also see it around the mouth as well. So here's a later stage. Now it has this yellow crust that I was describing earlier. So all of the blisters probably burst already, liquid came out, and now you have all this crust all around. So since they got impetigo around their mouth, you could see it's this later stage now. And this is like if it wasn't treated on time, when it was a red source, and it progressed until becoming this. These are some images I wanted to show so you could get a better understanding of what impetigo is. And I thought it was really interesting to know about this because it's actually really common, and you could see it like in daycares and children. It's really common. So I hope you liked this video because I also really loved getting to know more about this, researching. It was like really interesting. So I hope you liked it, and thank you for watching. Bye! Be completely humble and gentle. Be patient, bearing one another in love. Make every effort to keep the unity of the Spirit through the bond of peace. Ephesians 4:2-3.